Hello everybody and welcome to the Thursday edition of Video Clips. And first of all, just a quick announcement. Remember that school starts in a month, well, a little bit over a month actually, the week of January 13th. The Wellness Farm Institute will be offering several classes, a couple of them for the first time, healthy institutional food management and meal planning, an almost like medical dietetics course to help people plan meals around various illnesses, etc. So anyway, if you're going to register or you want information, get a hold of us now so we have plenty of time to get everything taken care of before school starts. Although we just love the last minute around here. It'd be so great if we didn't have to do it all the time. All right, so let's talk about something positive today called honesty in medicine. And I'll just start by saying health and medicine have been so corrupted with conflicts of interest, and I focus on this only because I want to make people more cautious when they interact with health professionals and make decisions about what to do with their body. I think there's a growing realization that the system needs to change, and while government remains a part of the problem, at least the National Centers for Medicare and Medicaid Services is going to start publishing the amount of money doctors receive from drug and device makers. Most people will probably not even know that this database exists, but the mere thought that the information is being posted may make a few doctors think twice about the number of companies that they take money from and which companies they are and that sort of thing. Now, I've always thought that it would be a lot better if the medical profession cleaned itself up from within. And a doctor in Washington, D.C. has proposed that doctors do just that. Leana Wen thinks that docs should tell patients about their conflicts of interest or advertise that they don't have any. She's already started introducing herself differently at George Washington University Hospital, saying, and this is her quote, "I'm Dr. Leana Wen, I'm your doctor. I belong to an initiative called Who's My Doctor that aims for transparency in medicine. I accept no money from drug companies or device companies. I don't make any more from ordering more tests or procedures on you, and I also don't make any more for ordering less. I'm telling you this so you can be sure that everything I do for you is in your best interest." What a way to start a meeting with a new patient. Dr. Wen has published articles online and blogged about her, quote, total transparency manifesto in the Huffington Post. She says that other docs have also pledged to do this, but she wants to expand her efforts further and has built a website on which patients will eventually be able to check out their doctors or search for doctors who've actually taken the pledge. Some doctors are embracing her suggestions while others don't like it at all, claiming that patients have no right to be distrustful. I mean, I can't even believe somebody can make that statement with a straight face in this day and age. Dr. Wen has a real personal reason for pursuing this. After her mother died of breast cancer, she discovered that her oncologist was paid as a speaker and consultant for the company that made the chemotherapy that he prescribed. Now, she acknowledges that this doesn't mean that the treatment wasn't a good idea, but the arrangement does really cloud the issue. Wen says that patients often ask her why she's giving them the conflict-free speech. Many patients are not even aware that doctors take money from drug and device makers or that they have arrangements that might draw into question their clinical decisions. And this is exactly why it's so important. Most medical consumers are simply unaware of the things that can go wrong and why they go wrong, like conflict of interest in the medical profession. Dr. Wen discloses a lot about herself. I'm starting to like this woman a whole lot just reading this to you, and not just her finances. On her website, she says she receives 55% of her income from patient care in the form of a salary and bonus based on her academic activities. Research generates 40%, and the balance comes from speaking fees and royalties related to her writings, which include a book called When Doctors Don't Listen: How to Avoid Misdiagnoses and Unnecessary Tests. She has never smoked, and she criticizes the sick care system in which we design fancy marble staircases, she said, in our hospitals, but we don't train our staff members to respect basic human dignity. We make our patients undress at a time that is scary and vulnerable, but we don't ask our doctors to share even the most basic information about themselves. Some of her colleagues claim that payments from drug companies or personal habits are none of a patient's business, but she insists that these things are, and I agree with her. Still others argue that many doctors collaborate with manufacturers in the interest of better science. Well, if this is indeed the case, then why the reluctance to be honest about it? And then there are those who argue that the time with patients is already so limited, so patients aren't interested in these things. Just the paternalistic response we've come to expect from so many people in the healthcare profession. In any case, in my opinion, the patient can decide whether or not this info is interesting, and my guess is that more patients will pay attention to it as they learn more about this and as information becomes readily available. And I think at some point in time, patients will avoid doctors who don't disclose this type of information, figuring that they must have something to hide. Wen is committed to going forward and building her website, but the cost is expected to be high. And of course, the usual sources of funding, the drug and device makers, are not behind this idea at all. But she says, quote, "I feel very passionate about making a difference in medicine. At least I can do my part." So I really think this is a great idea. I really think that transparency is what we need to see. We need to see it in medicine. We need to see it in politics and just about everything else. And I agree with Dr. Wen. If there's nothing to hide, then what would be the problem in putting out all of this information? And I think we should let patients decide what they want to know about. I don't think that information should be withheld with the assumption that the patient must not be interested. Well, that's all for today. It's all for this week. Have a wonderful day and weekend, and I will be back to you again on Tuesday.